All right, let's dive into a medical mystery. And this one starts with something we've probably all seen before, just a simple summer rash. But what happens next is this incredible diagnostic journey. It's part detective story, part science lesson, and it all kicks off with one single skin lesion that just wouldn't go away.
So just imagine this. An 11-year-old kid is out enjoying his summer vacation, and he gets a little rash. No big deal, right? We'd probably just brush it off. But what if that so-called simple rash didn't just fade away?
And this is exactly where our medical mystery begins. What seemed like a really straightforward little problem, well, it quickly turned into a puzzle that was really going to test his doctors.
Okay, let's follow the timeline here. The rash shows up sometime during summer vacation. By the middle of September, weeks later, it's still there. So off to the pediatrician they go. They try a standard topical cream, but a week later, nothing. It hasn't improved one bit. And that's really the first big red flag that something else is going on here. The first guess, and it was a totally logical one, was tinea corporis. You probably know it as ringworm, especially since the lesion was ring-shaped. But when that standard antifungal cream did absolutely nothing, that failure itself became the first major clue. The initial diagnosis? It had to be wrong. So, with the most common explanation off the table, the medical team had to start their real detective work. It's a process called differential diagnosis, which is basically just a fancy way of saying they had to eliminate all the other suspects, one by one. And here's kind of how they did it, how they narrowed down the possibilities. They looked at ringworm again, but a key thing was missing. It wasn't itchy at all. So, nope. Then they considered erythema multiforme, but that usually shows up as multiple spots, not just one. So that's out. Granuloma annulare was also a possibility, but it just didn't fit with where the rash was on the boy's body. See? With every possibility they ruled out, they were getting one step closer to the real answer. Okay, so with all the usual skin conditions ruled out, the investigation took a really interesting turn. It went from looking at the skin itself to looking at the environment. The doctors started thinking about the boy's summer activities and considering that maybe, just maybe, the cause wasn't a fungus or an allergy, but a bite. And this brings us to this important concept called zoonosis. It's basically any disease that can be passed from an animal to a human. And a very, very common carrier for these kinds of illnesses, the tick. Since our patient had been spending his whole summer outdoors, this idea suddenly shot right to the top of the list. Now, for tick-borne illnesses in that particular region, two main suspects really stand out. First, there's Mediterranean spotted fever, which usually starts with this very distinct black spot where the bite happened. And then there's Lyme disease, which is famous for that bullseye rash. The key to this whole diagnosis was sitting right there on the boy's skin. See, the boy didn't have a black spot. What he had was that classic expanding ring. I mean, the visual evidence was just overwhelming, and it was pointing almost exclusively in one direction. But you know how it is in medicine. A really strong suspicion, even with great evidence, isn't enough. You need to confirm it. It was time to go to the lab and see if the blood work would finally back up what their eyes were telling them. So the team ran a whole panel of tests, looking for the antibodies that would prove what bacteria they were dealing with. And everyone was just waiting to see what those results would show. And here they are. The test for Mediterranean spotted fever, negative. But the test for Borrelia burgdorferi, that's the bacteria that causes Lyme disease, it came back positive. And on top of that, the elevated liver enzymes confirmed it. That tells you the body is actively fighting an infection. Boom, they had their culprit. And just like that, after weeks of questions and uncertainty, the mystery was finally solved. That persistent summer rash finally had a name: early localized Lyme disease. Now, this case is such a powerful reminder of why prevention is just so important. So, what can we all actually do to stay a little safer, especially during tick season? First off, if you do find a tick, getting it off the right way is absolutely critical. You want to use fine-tipped tweezers and grab it as close to your skin as you possibly can. Then just pull straight up with steady, even pressure. Don't twist it or jerk it. And afterwards, make sure you thoroughly clean the bite area and your hands with soap and water or some rubbing alcohol. Of course, the best thing is always to avoid getting bitten in the first place, right? So when you're out hiking or camping, use repellents, wear protective clothing, and this part is so important. When you get back inside, do a full body check. Check yourself, check your kids, and definitely check your pets. And don't forget to keep them up to date on their flea and tick prevention too.
So let's kind of bring it all home. What are the big takeaways from this whole case?
Well, first, the great news. What about our patient? Once he was correctly diagnosed, he was given a simple course of antibiotics. And that lesion, the one that had been hanging around for weeks, it completely disappeared in just 3 days. A fantastic outcome. And it just goes to show you the power of getting the right diagnosis.
This quote from the actual case report pretty much sums up the whole thing. The biggest hurdle here wasn't some exotic, untreatable disease. It was simply considering Lyme disease as a possibility in the first place. That clinical suspicion is everything. And really, this is the main takeaway for all of us. This story isn't about being afraid to go outdoors. Not at all. The vast majority of tick bites are completely harmless. It's just about being aware, knowing what to look for. A rash that doesn't go away or one that gets bigger over time. That's what empowers you to get help early, when the treatment is at its simplest and most effective. So I'll just leave you with this thought. The next time you come back from a walk in the woods, you're not just checking for a few scrapes anymore, are you? You're checking with a whole new level of awareness. Thanks for diving into this with me today.